What we want to accomplish with this video is instruction, tips and pearls for application of seal small rail fixation for triple arthrodesis. What we'll need is a total of 4 rails, 2 cars per rail for a total of 8 cars. In this particular instance, I'll use 2 centrally threaded 4mm pins, and surgeon preference, whether it's 3mm or 4mm for fixation in the forefoot. In this presentation, we're going to be using 4mm Chance pins, and you'll need 2 of those. After our fixation is in place temporarily, and I use Steinman pins to hold our triple arthrodesis intact, primary closure is obtained. At this time, we need to apply our external fixation. The first pin that I throw is a 4mm centrally threaded pin through the talar neck. This area is the area of fixation that offers, I feel, the most tricky positioning. When you're dealing with external fixation, you need to throw your pins or wires from the area of greatest concern to the area of least concern. With the talar neck fixation pin, the concerns that we have, the ability for this patient to be able to freely move their ankle, because many times this fixation is utilized with a patient that is allowed to weight bear. We also do not want ankle impingement or soft tissue impingement or damage of ligamentous structures that were not involved with the surgical procedure. Because the fibula sits more posteriorly at the level of the anterior ankle, I believe it's important to throw this pin from medial to lateral through the talar neck. It is my preference to try to stay as proximally in this area of anatomy as possible. And if I have to err, either dorsal or plantar, because I'm going to be compressing plantarly and posteriorly, I would like the largest amount of bone to be in that position. So if you have to err in the talar neck, err a little dorsal with your pin fixation. We try to make this pin as parallel to the weight-bearing surface and the long axis of the bone as possible. But with this fixation device, you'll find that these pins can be in virtually any position and still be able to be fixated appropriately. As a rule of thumb, I will drill until I see the most proximal portion of the thread disappear into the near side soft tissue of the patient. Before we consider even utilizing the rail as a guide, we throw our second centrally threaded 4mm pin into the calcaneus. It is important to note that while you can use the rail as a guide for Chance pins, you cannot utilize it as a guide for a centrally threaded pin, as these threads do not pass through the rail's collet design. I believe it's important to try to make this pin as parallel to the talar pin as possible, though again, it is not necessary for this type of fixation to have your pins be parallel. We can see here our talar and calcaneal 4mm centrally threaded pins. At this point, I like to apply the more proximal components of fixation of the seal small rail system, and that is the component that will be compressing the subtalar joint. Here, medially, it is important to note that for your first procedures, the representative will certainly be in the room with you. The device slides on very easily, and then we slide our lateral component. I like to make sure I remove, in this case, sawdust, but in the clinical case, any bony debris away from the central threads of the drill, so that we do not have anything that would impede our collet device from sliding evenly. Our Allen wrench can be used to tighten. It's important here not to over tighten. We then can use the more distal component of the rail system to act as a guide, sliding the proximal component of this distal rail on the pin that's centrally threaded that was already thrown, and then utilize our rail to act as a guide to throw our navicular pin medially. One excellent component of this frame that was discovered later on through clinical application was that many times with resection of the talar navicular joint, you end up with a wafering of the navicular, especially if you utilize a saw to resect that joint. Even with aggressive curettage, you sometimes end up in a situation where you need additional compression across the TN joint. Because this is such a close anatomic structure, if you were to place these pins or be restricted where you had to place these pins parallel, you would be limited in the amount of compression you could get across the TN joint. Because of the 180 degrees that's offered at the level of the car, the 60 degrees that's offered at the level of the collet, and the virtual 360 degrees that you can get of the car on the pin, you're able to bring your hand distally, bring the pin on a proximal trajectory, and catch the full area of that navicular, increasing the area that you can compress on the rail by greater than 1 to 2 centimeters. So if you like the appropriate position and you want to get great bicortical purchase, which is desired, you can certainly get that with this device. It offers no compromise to the surgeon for where they want to throw their pins. We now will focus on the fusion for the calcaneal-cuboid joint, utilizing the calcaneal pin component of the 4mm centrally threaded pin. We can then utilize our frame as a guide to position in the cuboid. At this point, fine-tuning and adjustments of the rail over the pins is very easy, as these pins could have all been thrown without the aid of the frame, and the frame slid on afterwards. Getting the appropriate 2 fingers breaths away from the patient, you can then apply, tighten all of your cars down on the rail system, and dial in your appropriate compression evenly and reproducibly. For the subtalar joint, simply take the Allen wrench and perform clockwise rotation until you get the desired compression, both medially and laterally. For the TN joint, same applies. For the calcaneal-cuboid joint, same applies. Your finished product, after pins are cut and pin caps are applied, will look like this. Here demonstrated with a 3mm pin at the talar navicular joint and 4mm pins as in our model. That is the lateral component completed, medial component completed. Again, I'm Dr. Thomas Rocchio. I hope this video was informative. If you have any other questions or would like to speak to a representative, please contact the SEAL local representative in your area.